Astrid Burkle, a 10-year-old transgender girl living in Ohio, said she wishes she could have a normal life. Astrid said wished she could do everything other 5th-grade girls did. Bake cookies with grandmother, sing with her friends in the local choir, and go on field trips, but instead had to spend time studying at home. Regular visits to the statehouse to advocate against anti-transgender legislation that could affect Astrid in the future. It's really frustrating sometimes, Astrid told ABC News in an interview with her family. Because there are so many people out there with really bad intentions. Families across the state are bracing for the impact of a bill that would restrict certain transgender rights for minors. Ohio House Bill 68 consists of two bills: the Save Adolescents Experimentation Act, which would ban transgender minors from receiving gender-affirming care, and the Save Women's Sports Act, which would bar transgender girls participating in girls' and women's sports. According to medical experts, gender-affirming care is about supporting someone's identity. It helps align their physical appearance with their gender identity and may include mental health services as well as medical interventions such as puberty blockers, hormone medications, and surgery. These medical options would be banned by HB 68, a member the Ohio chapter the American Academy of Pediatrics. Pediatricians and doctors are extremely cautious about gender-affirming care and often have long conversations with people that gender. Christopher Bolling said in an interview with ABC News, they question their gender before considering age-appropriate medical interventions according to treatment guidelines. This gives patients time to explore their identity and create a personalized approach to care. Puberty blockers for teens approaching puberty are a reversible form of gender-affirming care that allows children to pause puberty and explore their sexual identity before permanent gender characteristics develop. According to doctors interviewed by ABC News, this option will be prohibited by legislation. It would also ban hormone therapy that aligns physical characteristics with gender identity. Doctors who spoke to ABC News said surgeries are rarely performed on teenagers and are evaluated only on a case-by-case basis. Astrid's mother, Alicia Burkle, said Astrid had received rigorous mental health services in recent years because she was too young for medical care. Physicians providing this care will be subject to discipline by the appropriate professional licensing board. An exception in this bill allows hormone-based care and surgery for intersex and cisgender youth. DeWine has not yet announced whether he will sign or veto the legislation, but more than 3/5 of legislators have voted in favor of the bill so far and could override his veto. Astrid's mother, Alicia Burkle, said Astrid has definitely received mental health services in recent years. Burkle